Health and Wellness is a department in student life dedicated to working with students on a variety of issues. We may be working with students on getting connected academically to the right advisor, we may be helping students get connected to counseling services on campus, or we may be working with students to create a plan to address some of the barriers that they're facing that's getting in the way of keeping them academically engaged. Health and Wellness is comprised of 6 different programs. We have our student care program, which is our broadest based program, working with students on a variety of issues. We also have our alcohol and other drug education program. Our focus is really on harm reduction. We know just say no doesn't work, so we really focus on empowering students with information to help make better choices for themselves. We have our sexual assault and relationship violence advocate, who works to make sure that students are supported and also know what their rights and options are on campus, both in terms of reporting and help-seeking services. Our suicide intervention program works with students who may be struggling with thoughts of suicide. We help connect students to services on campus, and we also consult with friends and family members who may be concerned about a student who's struggling with suicidal ideation. Our training and education program provides training and education to students, faculty, and staff on our health and wellness programs, bringing the latest evidence-based research and education to our campus community. We also have our peer health educators, a group of students who are dedicated to empowering their peers on campus, talking about the variety of issues in health and wellness.
The peer health educators are kind of the student-led education and outreach branch of health and wellness. We talk to the Greek community, we talk to RSOs, we talk to other first-year groups. Students look to each other when they're in need. And so if we can kind of bridge that gap between information and resources, and if students can kind of provide these resources to each other, then that's kind of what FEES are all about.
So the mission of Health and Wellness is really twofold. We do a ton of education on campus, but we're also doing a lot of one-on-one work with students. When students come to Health and Wellness, they can expect to have a conversation with a staff member about what's going on with them. They can explore their options, share as much or as little as they want about their individual situation. The staff in Health and Wellness make sure that students feel heard and connected and supported.
My experience with Health and Wellness made me feel very empowered. It made me feel that no matter what the situation may be, I have a staff that's ready to help me out.
So whether we're talking to a classroom of 600 students in Kane Hall, or we're doing an individual one-on-one session, Health and Wellness really wants to make sure that we're empowering students, that they feel supported and connected on campus.